Right, so what I want to get through on this session is for you to understand the difference between tactics and strategies and tactics when you're designing a program to get health improvement, nutrition health improvement, and for you to understand the key stages in doing that and how you can measure the outcomes of that. So this is a diagram to explain the strategic planning process, and as you can see, you go through a series of logical steps. So you start with analyzing your problem, what's causing it. Okay, it's not simply there's obesity. You need to understand all the causes about that, and we'll unpack that a bit in a minute. You then work out what are your options for intervening. Who do you want to intervene with? Are there different audiences, different groups of people? Because it's not necessarily that a one-size-fits-all. The same thing doesn't necessarily work for everyone. What you want to do for young children will be different to what you might want to do to elderly people, for example. You've got to then work out what is the behavior you want to change. What do you want them to do that they're not doing? Who are you going to work with on doing that? And all that is the strategic part of it. Okay? The tactics, the how you do it, is the message. What is the message you're going to say to them? Eat 5 a day. Eat less salt. Those are the messages, right? How are you going to get that through to them? What media? TV, ads, radio jingles, posters, leaflets, whatever you're going to use. And then how are you going to know it's working? And this is a continual cycle, because once you evaluate, your evaluation will show you, has your program worked? If it has worked, okay, now I need to go to the next stage, so I need to work out how do I get to the next stage, and you start it all over again. If it hasn't worked, you have to work out where were the problems, how do I fix them to get it to work. So it's never a static thing, and it's never this, and you're always evolving a program, because hopefully you're solving a problem, but another one will come along, okay? So the important thing to remember is that, okay, I'll ask you, what's the difference between strategy and tactics? This might be subtle, so I'll focus on Oxford Brookes, since English is your mother tongue. Do you understand by the difference between strategy and tactics? Sorry? Okay, so we're talking generals and specifics. A bit more than that. Yes, I think you're on the right track there. So strategy is what has to change. So you're planning about working that out, and the tactics are how you're going to do it. Okay? If you think back to the previous one, the strategy, the problem analysis, all this bit identifies for you what has to change and how you're going to change it in terms of who the players are. And the tactical is the details, the nuances, the interventions you're going to do, the messaging, the communication to get that behavior change, okay? Now the important thing here is most of us prefer to focus on the tactics because they're more interesting and they're more fun. But if you don't do the strategy, it will not work. You need to go through that problem analysis to get your message to work, okay? So in problem analysis, we can use the concept mapping as a way of working out what it is we need to do. So when you're thinking about a problem, you need to go through a stages of steps. So for example, if we take obesity as an example, what's the problem? What contributes to it? Well, the problem is excess fat storage. So and we know that because its weight in relation to height has gone skewed. The causes, they're biological causes, some of it may be genetic, they're environmental causes, access to junk food, fast food, cheap fast food, behavior, don't know how to cook, it's easy for me to get that food, services, well in schools, you know, there's lots of chips, less healthy food. So all those things can cause obesity, as I think other speakers have spoken to you about. There's the natural history of who is affected, the person, place and time. So as I'm sure previous speakers told you, we're seeing obesity and problems associated with obesity now occurring in younger children, not just adults. So there's been a change over time in the prevalence of obesity and who's affected. We know that the problem's getting worse, and we know some of the predisposing factors. They're the environmental and the political factors. Who are the stakeholders? So stakeholders will be things like the food companies, the beverage companies, our governments, ministries of health, all the people who have a role in delivering of our food. And what have they done in the past? You know, you could say, well, the food companies have advertised, you know, all these deals, you know, 2 for 1 on the less healthy foods. That could be a predisposing factor. They haven't helped us in solve the problem. Some would argue they may have helped us make the problem worse. So you have to look at what has been their behavior, what have they done that may have exacerbated the problem or may have stopped the problem getting worse. The historical factors, okay, that's what programs have worked, what's been tried, what works, what doesn't work. We might also want to think about what's worked in other sectors that we could learn lessons from. So for example, in, say, reproductive health, you know, where people may pay a bit more attention to things that affect them directly. How have they got behavior change? Or even anti-smoking. How have they got the behavior change with anti-smoking, stopping smoking? Can we learn any lessons from them that may be applicable to changing diet? We might not have all the solutions, but so we can look to see if we can learn lessons from other sectors. Clearly what resources are available, the amount of money. And not only money in actual physical money, but resource in terms of expertise and collaborators. And then, is there any other information you need to know around the problem? So you need to go through a whole series of questions to work out the underlying issues around the problem. So concept mapping is a simple tool for how you organize your thinking, okay? And so it can help you identify the association between factors and the interventions, the strategies, the programs you can put in place, as well as to plan public health campaigns. So if I use an example here of a concept map for obesity. So obesity is our problem. And then we have nodes. So we have to identify the stakeholders, the causes, the interventions or the programs that can work, and the outcomes. And then for each of those, there's a whole other series of questions. So the nodes, for each of those, you then go and identify those components. So for the causes of obesity, we'd want to know, what do we know about the biological, the environment, the behavioral, and what services are there that can help solve that problem, that are related, service delivery. For the effects, we need to know the cost. What does it cost to be obese? You know, in the UK, they're estimating it's £5 billion, which is about the same in euros a year, is the cost of obesity in terms of chronic disease and all the associated things that go with obesity. which is why governments are so concerned about obesity now, because of the cost to the economy. The trends, if you've got people with high blood pressure and cardiovascular disease, you're going to have, effects on work performance, effects on absenteeism from work. So the trends in the effects are also important because they will have knock-on economic costs. Likewise, the effect on morbidity and mortality. For the stakeholders, who are they? Well, at the global level, there's a World Health Organization. They're concerned about this. They're the funders, our governments, whoever might be private sector there as well. The policymakers, the people who deliver the services, so the healthcare providers, and then the communities. There may be an issue at a community level. Especially if you're talking about local level resources for creating programs. So recreational programs, if you want to increase physical activity, that might have a cost at the community level because that would be money that might be used for something else, or they might choose not to use it for something else. And then the interventions. What are the goals and the values of the intervention? What's the purpose of the intervention? What do you aim to get out of it? Is it effective? What enables or hinders the intervention working? Not all interventions work, and they don't work for different reasons. You might have, there's a promotion of cycling, riding bicycles, but if there's no pathways, children aren't going to ride bicycles. So, it's all very well having an intervention on paper, but you've got to enable it to work by having the components in place. And of course, what works. And then there are interventions at primary, secondary, and tertiary level. So do you understand those terms, primary, secondary, and tertiary? Yes? Does everyone, what's primary? Sorry? It's prevention at a population level, okay? So it's general to everyone. Secondary is, what's secondary? Targeted. Yes, targeted intervention. And so tertiary is individual, so that's almost like therapy, okay? So you're going to get interventions for all of those, at all stages, for all of those. So if you unpack each of these, so if the node for causes, some of the key questions, examples is, what would you want to know about the cause? So the biology, the behavior, what do people currently do? What is their diet like? How much physical activity do they do? And is there compliance? Do they actually do it, or are they telling you what they want you to hear? So going back to the example of cycling, if they say, oh, children cycle, but how much do they cycle? Is it just on Saturdays when they go out with dad, or do they do it every day, to get a good sense of how much physical activity are they doing? The environmental factors, these are the socio-cultural things as well as physical things that may or may not constrain things. So obviously, environment's very important in terms of food production, access to food, food security, so that's that access, availability and affordability. If you're dependent on food being imported, it's going to be a lot more expensive than food that's produced locally. And then what services are available for nutrition-related activities, and are they used? So you may have, for example, if you think about anemia control, you might have a prenatal program for delivering iron folate supplements to pregnant women, but do they take them? Just because it exists doesn't mean it works. So you need to understand whether people are adhering and doing what you're recommending that they do. And once you know your causes, you have to then think about what can be changed. And what can be changed in the short term, and what can be changed in the long term. Behavior is very, very difficult to change. So some things are easier than other things. So, for example, in the UK, take salt, we had, our salt intake is high, although it's better than many other countries. And what the food industry did was start to reduce the salt content of a lot of processed foods. And 75% of our salt intake comes from processed foods. So by industry doing that, has enabled salt intake to go down slowly. So that was relatively quick to change, and industry did that voluntarily. You know, it's now much more difficult to get people to stop eating processed foods to get that intake down further. So you have to think carefully of what can you do in the short term, what can you do in the long term, and how do you message that? How do you get the public to understand that as a preventative measure for hypertension and all the salt-related factors? If you look at the outcome and the effects, examples of key questions, these are obvious, taking obesity again, what are the effects? You've heard a lot about that the last 3 days. And are the effects differential? Do they affect different groups in different ways? And clearly, you know, for us today, a very big question and concern is this obesity in children, because an overweight obese child is likely to end up an overweight obese adult. So that accumulation effect is even longer than, say, obesity developing in adulthood. And do we know what that's going to do? Might it bring lifespan down? Is it going to create even more complications than we know adults currently get? So the effects are definitely differential. Whether we have the answers is a different matter. What do we know about the economic costs? We have a certain amount of information on that, and as I mentioned, they're huge, and trends over time, and those data are increasingly more available. And as I mentioned earlier on, data such as the data collected in the UK through the schools program is a very good marker for trends over time. We can see that obesity or high risk of overweight is already prevalent in 5-year-old, 6-year-old children, which means that we're getting 2-, 3-year-olds who are more overweight than they should be, because they're coming into 6 years old with a large number who are already overweight. Stakeholders, who are they? I've mentioned the food companies. They may also be the gyms, the companies that do the sports companies as well. They have a role to play. It's very important to differentiate between physical activity and exercise. They're not the same thing. But the public doesn't always understand that. They put the two together. So if you think about what the recommendations are for physical activity, they're actually not too bad. You know, half an hour of moderate physical activity a day, or 5 days a week, which is, you know, walking for 30 minutes. It doesn't mean going and working out in a gym, but the public assumes when you say do more physical activity, they mean go jogging or to a gym. So we do have a big perception issue there, which we can use health improvement to get people to understand. It doesn't mean that. You can do it, you can improve your physical activity, and it can have benefits. How do we get the stakeholders to support obesity control? So that's moving along the social corporate responsibility. In the UK, for example, we now have the government has a voluntary responsibility deal with the food sector. Not all the food companies have signed up, but some of the big supermarkets have, and some of the fast food chains have, like Subways, McDonald's, people like that. And they have said they will show calories, the amount of calories on their menus. They will not put salt out, and they've got various things that will improve or make their foods healthier and inform the public that their foods are healthier. So you can enlist the support. Whether it works, we don't know. There's a lot of cynicism about it because companies can say that to make themselves look good, but in fact it doesn't do anything. We don't have the evidence yet whether it's working or not. And then the other thing is, what role should these companies or stakeholders have in change? Again, a lot of concern that people who, or food companies and beverage companies whose mandate, who are there to make money, let's face it, they're businesses. So is their profit more important than good health? And there's always a big debate on that. So lots of issues in there to think about. In terms of interventions, again, what do we know about what works and when to intervene? So lots of different things in physical activity, more recreational facilities, sports clubs, cycle paths, subsidized gym memberships, things like that. Advertising is a key thing, controlling advertising. So I'll give you another example. In the UK, advertising of foods targeted to children is not allowed before 9 o'clock at night on television. So it's to stop that influence. There's also, I think, some regulations about what can be advertised in magazines and things targeted to children, but I might be wrong on that one. Dietary modification, I'm sure you're all aware of those sort of things. Over-the-counter drugs, a lot of things purported, said, good for weight management. Most of them don't work. As you know, the only thing that is commercially available is that orlistat, that there are concerns about because, what is it doing to fat-soluble vitamins? If it's preventing the absorption of fat, what's happening to the fat-soluble vitamins in the meals? And certainly in the States, they've only allowed it to be used in snack foods because of the concern about what it might do to the delivery of fat-soluble vitamins. The expanded services, so services for early intervention, so postnatal care, prenatal care, all the programs targeted to health, immunization, all these other things. How can you build nutrition into those? They do exist, but do they work? How well do they work? Can they be expanded on? And of course, as a last resort, there's bariatric surgery. So this is just to illustrate that you all well know that the decision-making progress that one goes through in deciding what to eat, it's, do you want to eat a particular food? Where are you going to get it from? Where are you going to eat it? Who are you going to eat it with? When do you eat? What time do you eat? What do you eat? Do you consider it from a food point of view or a nutrient point of view? How much do you eat and when do you stop eating? All of these factors you need to understand because all of these influence how we eat. It's not simply food is there. There's a whole host of things that affect that decision-making process. Likewise with physical activity, whether you want to do it, where do you want to do it, who are you going to do it with, when do you want to be active, what do you do, how much do you do, and when do you stop? Going for a 5-minute cycle ride, you might think that does something for you, that's a sign of physical activity. Is it actually doing anything? So again, all those are things at which you can influence. You can affect behavior change at all those decision points. And it's working out which of the decision points are easier to change than others. Looking at the interventions, what is it we want to get out of them? Is it primary or secondary prevention? Is it multi-sectoral, or is it a health-focused program, or is it one that crosses sectors? So, for example, physical activity, you might engage the the Ministry of Transport. You know, even food, you might engage the Ministry of Agriculture, the Ministry of Commerce, the Ministry of Trade, whatever sectors are involved in food. Again, the public-private sector partnerships and time. Over what time period do you want to do this? And the key restraining factors, cost. Is it going to cost the individual something? It's, you know, having a program, for example, subsidized swimming, you know, people can get vouchers to go swimming, but it's going to cost them 10 euros to get to the swimming pool on the bus or whatever. It's not going to be an incentive for people to go. So it's not just a simple cost to the activity you have to think about, it's also all the extra costs for the people to do that activity or change that diet that you need to think about. Likewise with time. And competing priorities. You know, most people have a busy lifestyle, and to say you need to go and do more physical activity, if you're a mother with 3 children or 4 children and you've got school run, you've got after-school activities, you've got to get dinner on the table, you work, when do you do this? So, you know, we have to think about those sort of issues. And when organizations or institutions don't work together, you know, if the Ministry of Health doesn't work that well with the Ministry of Agriculture and you're trying to do a diet-related thing, it's going to be quite difficult to do. They tend to be silos. So that cross-organizational or institutional collaboration is actually quite important and quite time-consuming and not always easy to set up. But it is doable. And then what are the key enabling factors? What do we know about effectiveness? So what research has been done? What evaluation of programs? And this is where we're particularly weak. There's not a lot of good evidence for what works. We do a lot of things, but we don't evaluate very well. And then obviously the magnitude of the problem and the assistance of non-government organizations. So those could be like charities. So for example, in the UK, the British Heart Foundation, which is a charity organization, puts a huge amount of money into improving diet and lifestyle. They support research, they support programs. So it's not all just about government and private sector companies. It is also these non-government organizations. Continuing on that, what is the role of communication in your intervention? Do you want to just create awareness? Do you just want people to know that obesity is a problem? Or do you want to advocate to the policymakers, you need to do something about obesity? Because the way you communicate and to who you communicate will differ. It's never a one message for all. Do you want to educate people? Do you want them to know that, you know, eating 5 a day will make improve their nutrition? Cut down on fat will improve their nutrition. Do you want them to acquire skills? Do you want them to know that actually learning to cook isn't that difficult? Or do you want them to change their behavior? Walk to work, don't take the bus. Or take the bus, get off at the bus at one stop before you usually get off and walk that extra bit. So that's changing the behavior of what they do. Then how do you communicate to get that change? What's the best way to do it? And again, back to the long-term and short-term goals that have to be realistic. So one model of doing this is using the ecology of health. So you look at health in a context, and it's understanding that context which enables you to develop realistic programs. And so if you look at, this is the way the framework works, that you go from the communication will go from intrapersonal, so that the individual has to think about it and want to do something. People communicate with each other and influence each other, the interpersonal. The institutional organizational factors also influence that behavior. Likewise, the community could be, cultural issues in terms of food habits, ethnic foods, ethnic patterns, lifestyles, and then there's the population policy, which is effectively what governments, whether it's regional government or national government, do to try and influence. And the key thing is that you have to have a consistent message that cuts across all those barriers, because there's going to be barriers to changing behavior at each stage. Between every level, there are barriers and there are enabling factors, and your message needs to cut through all that, but it's not necessarily exactly the same message, because you might have to put it differently to a policymaker than to a mum of a 5-year-old, okay? So the key thing is that you have to have something that everybody understands, that it's not conflicting and it's not confusing. And that's one of the problems we often have, is people are bombarded with messages and they actually get confused. They're not quite sure what they're supposed to do because there's just too much information. And that's just in nutrition. And if you think about all the other message people are being bombarded with, they're being bombarded with things about, where to go shopping for clothes, or, what drink to buy, or which car to buy, or what the mortgage rate is, or what the rate of interest is, or which is the best bank. I mean, we're constantly bombarded with information. So we have to work out, how do we cut through that to get them to listen to our message? So the key thing is that, as I mentioned, to have a message that will resonate with people at each level, and that it's reinforced. So everybody's saying the same thing or understanding the same thing. In the short term, it's easiest to reach the center of that. It's easiest for you to hear the message and to maybe think about it, and your friends. So the intra and interpersonal. But the long-term challenge is to get the whole linkage working so that we're all saying the same thing. And clearly sustainability, which means that it won't stop, it will continue even in the absence of pulling back resources, that behavior is now embedded and happens naturally. That will be the proof that you've had a successful communication. So someone stopping smoking and they don't smoke again, that's the result of a successful communication, whether it was intrapersonal plus the messages coming from government, don't smoke, the legislation on smoking, the restrictions on where you can smoke, the price of smoking, what your friends think about smoking. All those things can influence you to stop smoking and you don't smoke again. We just need to work out how to do that for nutrition, diet and lifestyle, because it can work. We've seen it with other sectors. So that's the problem analysis. In terms of the selection of strategies, there's 3 things you need to consider. One is what needs to change. So from your problem analysis, you have to work out what are the key issues in there that can change to affect nutrition. And where in that model do you want that change to happen? How are you going to prioritize it? And then how are you going to get communication to do that? Okay? So this is just saying the same thing but looking at it schematically. In terms of your option mix, you can do basic health promotion and active and passive interventions. So an active intervention, for example, could be, the local authorities built cycleways so that people can cycle. So there's something very specific. A passive one might be nutrition labeling. So putting the nutrition parameters on a food product that people may or may not look at. And the evidence suggests most people don't look at those labels, although it's mandatory that they're on there. And then things like the policy level initiatives can be, there's a lot of discussion, and it's done in some of the Scandinavian countries, about taxing foods based on their sugar content or their fat content. So that's as a disincentive to buy those foods because they then become more expensive. That's a very controversial policy tool. So in terms of planning, when you're planning a program, the thing to consider is to make a table, as you can see I'm big on tables, of where in the ecological model you might want to change, at what level, the intrapersonal, personal, etc., and then to work out, decide what needs to change and how are you going to get communication to do it. Okay, so you start thinking about those things before you get into the tactical side. In terms of the target audience, lots of people have very, very different lifestyles. And not all their lifestyles are healthy. So you need to think about those factors and what it is that you want to change. Which of those health behaviors do you think you can change? So in choosing the right target audience, things you need to consider is who are the highest priority. So clearly that's going to be numbers come in there. Who has got, what is the biggest group with the problem? Which populations are most feasible to reach and influence? Okay, you might have a problem with a small sector of the population, but actually they're very difficult to reach. They may not, they may be an immigrant population who haven't fully immersed in the general culture, so language might be a problem. Their diets might be very different to the national diet. So yes, they have a specific problem, but you might use that as, you wouldn't use that as a big public health approach. You would target that group as a more at a community level, not as a national program, okay? Because then it wouldn't address the bigger needs of society. It's very specific to them. And then which audience are the highest risk and most vulnerable? So it's the, we know that young children are, thinking about obesity, are a high-risk group. We know middle-aged men are a high-risk group, particularly if they smoke and drink. We know the prenatal period, so pregnancy is a very important part because of, someone spoke to you about the whole thing of fetal origins of adult disease, so intervening there. But because people are living longer, the elderly are becoming an extremely important group that we need to worry about. We're part of that generation that are getting there, more and more of us that are going to end up living a lot longer as elderly people than in the past. So we can't ignore them either. Once you've got your population, you would then segment it into your different audiences, because as I mentioned, the same message isn't going to work for everyone. What you want children to listen to is different to what you want middle-aged men to listen to. So you would segment your audience into different groups. And on that you need to, as I mentioned before, you have to rationalize that that group, that population is large enough to justify the intervention. And can they be changed? So for example, some of the work being done that we've also looked at is particularly around schools where the fast food outlets are, and should the planning authorities at the local level restrict the opening of new fast food outlets so that they're not near schools, so that at lunchtime schools aren't going out, children are not going out to buy chips and other less healthy foods. Likewise, can you impose that children have to have school meals, because then you can deliver better, supposedly healthier meals. So these are some of the things you need to think about. Can you change that sort of environment to make access to food, the healthier options better? Are there political risks? I don't know about in other countries, but in the UK, we don't like the government telling us what to do. We think that's what we call nannying. It's like looking after children. So there's a tendency, if the government says don't do it, we react quite badly to that. So there's always political risks in how programs are portrayed so that the public doesn't just switch off. And are other groups reaching out to the population? And again, this goes back to the collaboration, because if other groups are already working with your target group, what you want to do is work with them to build on the good practices. Looking at the behavioral objectives, the goal can either be to motivate, so get people to understand what the benefit is of the change, to educate them so that they're aware of it, and that it's not usually a knowledge problem. If you ask most people today, I don't know about here, but certainly in the UK we have this 5 a day campaign, eat 5 fruit and vegetables. Most people know about it. Everybody's heard about it. They basically know what it is, but they don't do it. Okay, so they've got the knowledge, but they're just not acting on it. So that hasn't really been a big success in one way in terms of changing behavior. Empowerment. Do people have the confidence to do it? There's been some work done around Southampton, particularly with the poorer classes, socioeconomic groups, who tend to be, and what they found is that the less educated women, they don't have the confidence to change what they do. Their husband comes home or the children come home and they want chips for dinner. Well, these women choose their battles, and not cooking chips is not a battle that they choose to fight. They don't have the confidence to say, no, you're not getting fried potatoes, you're going to get mashed potatoes, because in terms of the family dynamics, that's too much pressure. So it's giving people the confidence to make changes, particularly in some settings is more difficult than others, say in a family environment. And then assisting people and enabling them to take action. The reward for what that they're doing, that people will see the benefit of what they do. They need to feel there's something for it. So if you say do more physical activity, it will reduce your weight. Well, if they don't see they're losing weight, they're not going to continue. So it needs to be something that's really tangible for them. And it's also got to be reinforced. The message always has to be reinforced. It just a single or few odd dissemination or proclamations of the message isn't going to have a long-term impact in terms of influencing behavior. So in terms of the factors that you want to target, these are fairly standard: attitudes, beliefs, knowledge, behaviors, and skills. And so, as I mentioned, you need to be clear to people what it is you want them to do after they've heard the message. Change their diet, go and do more physical activity, watch less television, things like that. And then in terms of the objectives, behavior objectives, you have to consider how the factors will have a positive effect on the outcome, and can they be measured, and what are the things that stop them happening? Why wouldn't people want to do them? And we've talked about things like money, whether it's an inconvenience. If you get all hot and sweaty and your muscles start aching after you go cycling, is that going to stop you going to do it on a regular basis? The inconvenience, the time, and the peer pressure. You know, this is particularly true for say, adolescents or children. If you're trying to encourage them to do more physical activity and their mates are saying no, their friends are saying no, you know, let's go and play video games or something. So, you know, that's the peer pressure can work with for all groups. So in terms of prioritizing your behavioral options, what you need to consider are the factors that are difficult and easy to change and put them in terms of their relative importance. Moving on to collaborators, I've talked about those, who they might be, the food industry, sports industry, policymakers, different sectors. So I'm not going to say any more about those. Turning now to the tactical, have you heard about the stages of change model? Are you familiar with that? Okay, and this came out of smoking, you know, how people move from deciding whether to give up smoking or not. And this is now a general model that's used for a lot of things around behavior change. And the key thing to do is to ask where in that process is your audience, because they're not all going to be at the stage where they need to be aware of a problem. Okay, and they're not, so you might in your program say, I'm going to have some at stage 1, you know, some that need to be that are at stage 3, or I need to give them the skills to become motivated. I need to influence their motivation. So you're going to have people at different stages, and what you need to think about is, how do I move that whole continuum to the right? How do I do it that it's not static, that I'm moving it all to the right? So ultimately you get to maintenance, but not everybody's going to get there at the same time. So your message should follow from your strategy, and it needs to work with what people's current beliefs are and their emotions, okay? Because if it doesn't resonate with them, it's not going to work. And you've got to tell them what's in it for them. So eat less salt, your risk of hypertension is less. Your risk of dying early is less. There's got to be something tangible in it for them to do, not simply because we think it's good for them. And again, so going back to the beginning, how do we do this? We have to do our problem analysis. You have to analyze the behavior change grounded in theory, okay? And I've gone through some of that. And you have to build in formative research or qualitative research, so whether it's focus group discussions or in-depth interviews with people, you need to do that work to really understand people's perceptions, both of the current thing and what can change. What would they be willing to do? What are the obstacles? What are the enabling factors? How can you build on those enabling factors? How can you reduce the obstacles? And then the challenge is finding the balance between reinforcing people's current view, so what they currently think and where you want them to go. And so in determining, once you've got your message, you have to pre-test it. A lot of what is done is top-down. People decide we need to tell people this is what they need to do, and then they just switch off. And that's, I think, what happened with something like 5 a day. They worked out from our National Diet and Nutrition Survey that if people ate 400 grams of fruit and vegetable, it would reduce the risk of chronic diseases. Well, we're not going to get people to eat vegetables, so we'll put fruit and vegetables together because they're more likely to eat fruit. And that message went out. But it's without really thinking, well, is this going to influence behavior, or is it just telling people information? And it certainly told people information, but there's not a lot of evidence it's actually changed behavior yet. So at the planning phase, you need to outline the elements that you want to include. So that's the promise. What's the benefit for you? The support statements, that will enable it, the tone and the net impression. So what will the person derive from the message, and is it something that they value? Why is it important to them? Reminding them why it's important to them, and do the benefits outweigh the obstacles? And then tone is extremely important. You know, whether it's humorous, whether it's emotional, whether it's intimidating, whether it's lecturing, and you need to think about things like that. So that you think about what is the listener going to think about? What is the take-home message for them? I've listened to this message. Do I care, or do I just switch off? Or do I think it's too negative? And then, as I mentioned, in designing messages, it must be driven by theory, and it must be sustained. You know, a one-time message never works, and it's important to think about how much advertising you see. We all know about Coca-Cola and Pepsi-Cola, but they spend billions on advertising, and they wouldn't do that if they didn't think they needed to. And that's what we're competing with public health nutrition. It's a huge challenge for us. The message needs to break through the noise of all these other messages we're getting, but you have to remember the message alone is rarely sufficient. So, for example, I always think it's quite useful to look at a message in something completely different, a different language, to see if I can understand it, because sometimes the message is too complex. And if it's simple enough that everybody should understand it, we should get a gist of what it is. So this one, I think, in the interest of time, I'm not going to throw it out to you, but I think you get a sense it's about dental health, sugar and dental health, you know, and what they can do. So there's a little bit of this, you know, there's a sense of humor in there, there's a sense of fun in there. And, you know, for the Chinese, that resonates with them. And then the media channels, you need to consider, what do your audience usually listen to? Are they radio people? Will a jingle work? Do they like posters? Do they like leaflets, etc.? The campaign goals, what is it you want to achieve? So if you want to achieve something that's very health focused, maybe a poster in a GP surgery or, you know, a doctor's surgery might be the right mode. Money obviously is important. Contacts with the media and how you use the media, how you can use the media is important. Whether there is, if you're using a campaign, whether it's going to be controversial or not, and how that process can be managed, and then obviously the strengths and weaknesses of every of your the channels available to you. And then finally the outcome and evaluation, which is extremely important, that checks to see whether you've met what you set out to do. Have you changed behavior? Not necessarily has that behavior changed a nutritional outcome, because there's quite a lag time there. Was there enough resources? Are there, you have to commit enough resources to make sure you evaluate. And this is where there's often a big shorting. You know, people put a lot of money into programs, but they don't put enough money into how they're going to monitor and evaluate and know their programs worked. You need to be flexible to accept it's not working, I need to change tactic, make adjustments. And it's very, very rare to be successful the first time round, which is why being flexible in your approach. So finally, I think hopefully these are the key messages. Think about multiple determinants. You've got to think multifactorially. You need to understand the problem. Think about how nutrition communication can be used. Have a mix of strategy, study the audience, which is separate to understanding the problem, and craft messages and use channels that will reach that audience, whether it's children, middle-aged men, the elderly, and constantly monitor and evaluate and refine your strategy and message. Okay, thank you.